Hello, ladies and gentlemen, parents, caregivers, welcome to Little Eyes Bright Futures, expert insight on children's eye health. I'm thrilled to have you join us today as we embark on a journey to uncover the secrets of maintaining impeccable eye health in children. I'm your host, Sonal Jain, Kids Wisdom Coach, and I am genuinely excited to welcome our today's speaker, Dr. Kirti Rani, ophthalmologist from Delhi. Our eyes are windows to the world, and as a parents, ensuring that our children's vision is vibrant and healthy is of paramount importance. In this podcast series, we are going to take you magnified look at the essential aspect of safeguarding your child's eyesight. From common eye issues that can affect kids, their underlying causes, to effective strategies, prevention where we are leaving no stone unnurtured. Childhood. Childhood is a time of wonder and exploration, but it's also when potential eye problems can arise. How do you know if your child's squinting, rubbing their eyes, or tilting their head is a normal part of growing up or something more serious? We have got you covered. Our episodes will be packed with expert advice from ophthalmologists and the pediatric eye specialists who will guide you through the maze of identifying the warning signs and taking proactive measures. Ever wonder about the effects of prolonged screen time on your young's eyes? Concerned about the influence of diet and lifestyle on the eye health? Or perhaps you are eager to discover the practical tips for creating an eye friendly environment for your little one. You are in the right place. Throughout this podcast, we will empower you with knowledge. Whether you are a new parent navigating the world of the child eye care or an experienced caregiver seeking to enhance your child's visual wellness, there is something here for everyone. So, get ready to unlock the mysterious of your child's eyesight. Subscribe Little Eyes Bright Future, expert insights on children eye health to and join us and we and uncover the essential aspect of maintaining the excellent eye health in children. Together, we will learn about common eye issues, their causes, prevention strategies, and how to spot the potential problems early on. I can't wait to embark on this enlightening journey with you all. So, I welcome Dr. Kirti Rani for this knowledgeable session, and I would like to invite her and say some few words about the today's topic so that parents will have the knowledge about like what is the exact problem and how we can come over it.
Hello. Thank you, Sonal. Thank you very much. Thank you very much for inviting me to this podcast. And you have taken a great initiative educating regarding children's health. So, this is a very novel cause which you are doing.
Thank
And
you.
I hope most parents will get some help from you. We as we are very worried nowadays for our kids that our kids are busy mostly on mobile phones as after covid most of the homework they get on the mobile phones, and even now 1 year 2 year kid know that they have to watch mobile phones and they are also in habit of watching this. So nowadays the parents are worried very much that what will happen to their kids eye. Will all these gadgets are going to affect their kids eye health? And also now the kids mostly they have junk food. They don't eat as healthy as we used to eat in our childhood period. So these are some factors because of the parents, because of parents get very worried about. And today we will talk about on this topic, and I hope that this will reduce the anxiety among parents so that they can more better take care of their kids' eye health.
Yeah. I have few questions, and I have received few questions from parents as well. So let's start.
Okay, okay, sure. So let's start.
Yeah. So the first question I have received is, how often should my child have regular eye checkup?
So initially, when your child is born, then first of all, he or she should have a regular eye examination during the hospital only after his or her birth, and then if you notice any changes which are abnormal in the eyes of the kid, like they might experience watering in the initial first year of their life, or you notice that my child is not able to see properly, he is not able to pick his toys, not able to pick the small things we can easily identify, or you have any abnormal activity, any abnormal deviation of the eyes. Normally when we see anything, both our eye move in a same manner. If we look
Yeah.
on the right side, then they both eyes go together in right, then in left. So if there is any abnormality in the movement of the eye of your child, then in these cases you should immediately go to a doctor. Otherwise, once in a year, a regular eye examination should be there for each and every child, because sometimes what happens is that you and your kid may not be able to appreciate some things. For example, he is having some difficulty in vision because he is a small kid only, and he doesn't know, he don't have any knowledge that how this particular object should look like, how much brighter, how much clearer it should be there. So the small kid don't have all this knowledge, as his eyes has not seen to so much clarity level. So after 1 year of age, child should get examination of his eye once in a year, and especially before they are getting admitted in the school, that is at the toddler age, before 3 years at least they should have one examination, and ideally every year they should go under a normal examination.
Yeah, that's really insightful. And I hope many of the time it so happens, being a new parent, we don't know what to do, and when to visit eye doctor. But yeah, it will definitely help parents to have some insightful ideas about it. So, what are the signs and symptoms of potential eye problems in children that we should be aware of?
So if we notice that child, if while we are seeing the child, if we notice as there is some abnormality in the center black part of our eyes, we all have black central black part of eye. If there is any change in the color of that eye, as it might become white in color or some orangish yellow color, or you notice that your child is not able to see properly, he is not able to pick all the small things which we are able to see and we are able to pick, not picking his toys, not able to see something which we are able to see, and having any abnormal watery discharge, if your child is itching eyes a lot, and there is redness inside his eyes, then in this case we should consult our eye specialist or ophthalmologist. As if these are very small signs, but as child will not be able to tell that I am having all this problem, so we as a parent should identify these few signs and symptoms, and we should consult our ophthalmologist.
Yeah. What lifestyle changes or the precautions should we consider to support our child's eye health?
Actually, first, the most important lifestyle changes is that nowadays the kid remain at the home whole of the day. So we encourage our kids to go in the park and have some play in the green on the green grass, as while walking on the green grass naked foot, so they have any beneficial effect on their eyes, and they will take some time off from the screen, will play in the park, will have a uh, good physique and good physical activity there. And if the child is constantly at the home, then he or she, either they are on TV or they are on mobile phone. So what happens is that they get continuously straining their eyes. They are continuously straining their eyes, using their muscles which are used for near vision. So because of the excess use of these muscle while watching on the mobile phone, it can happen that they might develop a glasses power in the future. So to prevent all this, we should really encourage our kids to go out in the park and have a good playtime in the park. And the second thing is that most of the parents are worried about the nutrition part of their kid. So the kid should have a normal healthy diet, but it should be kept in mind that mostly parents think that because of my child is not taking the green vegetable, not taking the carrots, not taking the healthy vegetables, as parents according to their mind think that my kid should take this amount, this amount, this amount. However, the kid is small and he or she may not be able to take too much amount if he is taking appropriate meals on time according to his age, according to his uh, appetite, then it's okay. Mostly the glasses power don't tend to develop because of the deficiency of the nutrition. The glasses power develop either during the growing age as the height of the child increases. Similarly, the length of the eyeball also increases along with the growth of the child. So, because of the increase in the length of the eyeball, as the eyeball keep going, the glasses power also start developing in the child's. Also, the hereditary, the glasses power also inherited from their parents. If the mother or father is having glasses power, then it's a natural tendency for the child also to have the glasses power. So the most important lifestyle change in the kids' life, which we could bring, is that they should go out and play in the park. That is very important in the today's era.
Yeah, you rightly said, because nowadays almost both the parents are working, and even the homemakers are busy with their work. So we can find that, even the children are very busy in their own activities and everything. We see that how we used to go to parks to play. So
Mhm.
nowadays, children are not getting that time to go out and play in the park. Yeah, but it is really important to go outside and play in the park so they can have, the better vision for their life when they play in the park, in the open grass, as you said. Yeah, it really works. So can you provide the guidance on how to manage my child's eye health in the different stages of development?
Okay. So as I said earlier, also, as soon as your child is born, then you should get his first examination done at the hospital only. And especially if your baby is a premature baby, then in that case, the examination of the eye become more important, because these premature babies tend to develop some condition in the eye, because of which their eye can even go blind in the future. So, especially if your child is a preterm baby, then at the hospital only he or she should have a thorough fundus examination from your ophthalmologist. And after he has come to the home, then if you notice any problem in his eye, then you should go to the ophthalmologist. Otherwise, after 1 year of age, he or she should get a normal examination. And then before going to the school, that is before turning 3 years of age, parents should have a regular examination with the toddlers. Otherwise, at once in a year, he or she should get examination. And in case is there any problem, like some children tend to rub their eyes a lot, which usually parents ignore. They thought that some dust might be in his eyes, that's why he is rubbing. But I have seen many kids, they have a severe allergy in their eyes because of which they are rubbing. And because of continuously rubbing, their cornea, which is the transparent part of our eye, it tend to become thin over the period of time. And these kids also have cylindrical glasses. And some of these kids after 10 to 12 year might develop a very serious eye condition which is known as keratoconus. So, and it might be so severe that the kid may require a corneal transplantation. So this is little problem of rubbing eyes may become very huge problem that it may even require transplantation of cornea. So the kid should not so the parents should not ignore if their kid is rubbing the eyes. So, and if there is any opacity, if you appreciate any white color uh, changes in the center of the black part of the eye, then this kid might have a cataract, and this need to be operated as soon as will show to the doctor sometime delay it that we don't have time right now. And because of delaying, sometime the kid became blind throughout his life because of this simple ignorance. So if any problem like this happens in the kid, then we should immediately consult a eye specialist.
I think this is a really important point which parents should take care of. Yeah, because as you rightly said, sometimes it so happens that we feel that it might be dust, but we never know what child is going through. So, are there any
Yeah.
specific habits or activities that we should encourage or discourage to protect our child's health?
First of all, your kid is at home, then please make sure he or she is not busy continuously watching the near activity. Even if the kid is doing his homework, then not continuously focusing on near things. Make sure that for 1 hour he or she studies, then ask him to go out or ask him to go to look at a distance. Because I have seen that if the kid is continuously focusing on the near objects, initially he was doing his work, then he or she busy in watching video games and on the mobile phone or watching some YouTube channel. So we think that the child has now taken care of his homework part, then now I can allow for video games. But because of the continuous near work, and the child is not playing outside because of continuous focusing on here, it happens time the glasses power tend to develop very small thing, but we should take care of this that after 1 hour please ask child to do some household work, keep him busy in some household work, or ask him to go to the outside for park, so the purpose of this activity is that child should focus at a distance object also in between. He or she is not continuously focusing on the near work. So this is the most important thing. Rest, the diet is important, but it doesn't have any so much impact on the eye health. So this is the only thing which parents should take care.
So how will the wearing glasses help improve child's vision over overall eye health?
Actually, if the kid is having a glasses power, then it's must for a child to wear that, because if the child is not wearing that glasses power, then his eyes do not see as clearly as we all see as having normal eyesight, and the eyesight in that kid is blurred. And during the growing age from 1 year to 8 to 10 years, our brain also perceive that image. If the brain is perceiving that my image is blurred, then a picture develop inside the brain that this is the maximum clarity which I have to see. And for the whole of the years during the development period of vision, in the initial 10 years of age, the brain have perceived that this is the maximum image clarity which I have to see. And brain doesn't, the things are even more clear than this. So if a child wear glasses, formed by become perfectly clear, as the kid should see, as we all perceive as having a normal eyesight. And oh no, that was a blurred image, and this is the clear image, and this I have to normal image. So if the kid is not wearing glasses in the initial 10 years, then permanently brain that I have to see this and this is maximum. And the kid doesn't realize age group, because it's don't have any knowledge that this is maximum clarity which I have to see. And once the child becomes in the teenage and he start going to the college and he appreciate that no, my vision is not perfect, my classmates are seeing all this on the blackboard and I am not seeing. And then when he go to the doctor, then at that time, even if he or she start wearing glasses perfectly throughout the day, even at that time the brain doesn't perceive that image, because the brain hasn't have any that clear image, and now the brain is fully developed and brain cannot further develop that image. So it's very important for children to wear glasses, especially during the initial 10 years of age, because if they don't wear at that age, then the vision is going to be uh, affected throughout their lifetime.
This is really new concept, what I have heard for the first time, and thank you for sharing that.
Welcome.
So, are there any alternative treatments or interventions we should consider besides glasses?
No, in kids, we prescribe glasses only. Our alternative option is contact lens, but the kid is small, and contact lens demand very good hygiene. The kid should not have any water drops while he or she is wearing contact lens. So the contact lens demand very good hygiene. They should be washed clearly. They should be worn properly, and kids should not sleep with the contact lens, enter inside the eye with the contact lens. So the for kids, the glasses are the best on the vision. Contact lenses, and even we have surgeries also. But in kids, the surgery is not prescribed because kid tend to grow. With the growing age, the glasses power will also increase. As the height of the child is increasing, the glasses power will also increase gradually. So there is no point of correcting it surgically. As suppose you have 1 year of age, and then when he turned 20 year of age, again some glasses power has developed. So only after the 18 lies, only then the surgical correction is advised. For kids, glasses are the best and they should wear the glasses.
So, how often should child wear their glasses? Is there any recommended wearing schedule?
Child has glasses, then he or she has to wait 24 hours a day apart from sleeping and taking a bath.
Okay. So, are there any situations or activities when child should remove their glasses?
No, no, no. If the kid is having glasses, then he or she should wear it throughout the day.
So, are there any common challenges or discomforts that child might experience initially? I think we lost the connection. Uh, Dr. Kirti, can you hear me?
Initially, for start 2 to 3, because it will.
Okay, so I think I could not hear your answer for the last question. Okay. So the last question was: are there any common challenges or discomforts the child might experience initially?
Are you able to hear me now?
Yeah, it is clear.
Yeah. Initially, when we prescribe glasses to kids for initially 2 to 3 weeks, they will have problems. As if a child is having plus glasses, then he will be having some head. He will have some distortion of image. The child might appreciate that all things are moving up and down, and this is very uncomfortable. Some might even experience initially that their vision get blurred even after the glasses, so the child might not be interested in wearing that, as he is not able to see from glasses. So initially the child will have problem for starting 2 to 3 weeks. And even some kids, some kids are very small, some are even 1 year 2 years of age, and as soon as the parents put the glasses, the kid throws them out. He's not willing to. He see, what is this? I'm not interested in this. So initially the parents has to face a lot of difficulty, but the parents should not lose hope. They should keep trying. They should be motivated throughout the journey that no, I have to make sure that my kid will wear glasses, because At this age, the wearing glasses is very very important for the future vision of the child. So initially the kid will have problem, but parents should have patience and keep it going throughout their journey.
So, are there any precautions the child should take while wearing glasses, such as screen time or outdoor activities?
Yeah, initially, if the kid is very small, then the precaution which we should take is that we should make the glasses polycarbonate glasses, not the glass one. As if the kid is playing outside and something hit in on the his glasses, then it might break if they are made of glasses. That is pure glass which we have in our crockery in kitchen. So it should not be made from that glass. It should be made of polycarbonate material, as the polycarbonate material will not break into pieces even if the child get trauma because of something. So ideally for kids, they should have a polycarbonate glasses, and the glasses one should be the glass material should be avoided in kids. And as the kid sometimes they are very small, so for kids we have special type of frame. Even the plastic material is very light, and so for kids we have a strap behind the glasses, so that the as kid bend forward, the glass should not fell on the floor. So these are some special glasses made for kids only, so parents should buy that only. They are very comfortable, and after few weeks the kid will also get comfort to that. And once the child sees that he is seeing much better than with these glasses as compared to before, so after 4 to 5 weeks the child will also wear glasses.
So, how often should we schedule the follow-up appointments to monitor like child's vision and the effectiveness of the glasses?
So initially, after the glasses have been prescribed to the kid, then your eye specialist will ask you to come after 1 month, as your eye specialist want to see what kind of improvement in the vision of the child. Sometime what happens is that even with the glasses, the child vision is not perfect. So he might give some alternate therapy. Some kid might need amblyopia therapy to correct this decrease in vision. And if the this amblyopia is corrected and if the child has having perfect vision, then it's recommended for kids to check his glasses power every 6 monthly, because we know that child grow very fast, and as a child keep on growing, the eye will also grow and the number will also grow. So every 6 monthly your child should have a regular examination for checking the glasses power. And once in a year, along with the checkup of the glasses power, your retina, kids retina should be examined also.
Okay.
So ask your eye specialist to examine the retina once in a year, and glasses power should be checked once in 6 months.
Okay. So, what signs should we watch for that might indicate that the need for the prescription change or adjustment to the glasses?
Okay. Once the your child is elder enough that he or she can appreciate that he is not able to see the blackboard, he is not able to see the news coming at the bottom of the your TV, or he is not able to see some letters on the bus number plate or vehicle number plate. So if the child is elder enough, then he or she will tell you that I am not able to see clearly as much as I used to see clearly. And in case you have a small kid which you think that the kid is not in an age group, that he will tell you. So if the child start squeezing his eyes like this, that's you have seen that some kids squeeze their eyes like this.
Yeah.
So they are not able to see, and hence they are trying to correct the vision by squeezing this. And sometimes the kid, you notice that initially the kid was watching television from a far distance, but now to see that he come very near to the television so that he or she can see that. Or if you notice that something earlier which you asked the kid that please bring that thing to me that is lying if at a distance, now the child is not able to see that. So as a parent you have to be cautious in this case. If you see any squeezing of the child, squeezing of the eyes in child, and the kid is watching television or other things from very near distance, sometimes you see that for reading copy or books the child sees like this.
Yeah.
It means that the kid is not able to see, and it's time that we should get a rechecking of his glasses power.
So, is it necessary for child to get his glasses power checked after putting eye drops? Because many children doesn't like putting this in their eyes.
Yeah, yeah. Actually, in kids, the accommodation power in the eye is very strong, and because of the strong power inside the eye, because of the strong muscle strength in kids, we are not able to assess the correct glasses power. So, if we want to have a correct prescription of glasses, then the glasses power should be checked only after putting eye drops, which are meant to check the glasses. However, these eye drops are very irritating, and some parents and some kids think that no, they very my kid became very irritable after putting eye this after these eye drops. He cries for some hours after putting, and even after putting these eye, your kid will be not be able to see the near objects for some with some eye drops. He might not be able to see for one day, with some for 3 days, for some he will not be able to see for 3 weeks. So the kids as well as their parents become very irritated that my child is having so much difficulty, so I don't want to get the glasses power checked after putting his eye drops. But for the first time, while your kids powers are prescribed, it is very important that you get it checked only after putting these eye drops. Otherwise there is no use of all this activity, no use of wearing glasses, as the kid might be wearing a wrong power, and it will definitely affect your kid's health.
So this is really nice to know that how actually it works. Thank you for sharing that. So,
Welcome.
my child is having a high glasses power. So, what extra precaution do I need to follow for him?
Okay. If your kid is having a very high glasses power, for example, your kid is having a glasses power around of -4, -5, -6, then in these kids, because of the high power, what happens is that we have a retina structure which is present at the back side of our eyes, and this retina is responsible for all the vision. If there is a damage in retina, then we will not be able to perceive the image which we are perceiving. And what happens in the kids with high glasses power is that this retina gets stretched because of the increase in the length of the eyeball. And because of this continuous stretching, for example, if we have a cloth which we continuously stretch for many many years, so what happens is that the cloth become tear from some part. You have noticed that either some hole develop in that cloth or it give up at any place. So because of the continuous stretching in the retina of our eyes of these kids, what happens is that sometimes these kids might develop a hole inside the retina, sometime a break in the retina. And once that happen, then after that a very serious condition tend to develop in this kids, that is retinal detachment. The retina get displaced from its normal position. The child is not able to see anything, and this problem required a very large surgery, very extensive surgery. And even after the surgery, even after a successful surgery, the vision will not be that perfect that it used to be before surgery, before detachment of the retina. So in these kids which are having a high glasses power, it's very important that you get retina examined of these kids once in a year. And if your kid at any point of time notices multiple black dots in his vision, or flashes of light, like we have a star coming, a what to say, टूटता हुआ तारा, or a breaking star, a shooting star, or if the kid see a flash of the light, or your kid notice that something is abnormal in vision, something curtain like thing is coming from one side, black color curtain coming. So in conditions, you show your kid to a eye specialist immediately and urgently. You should not wait for even for tomorrow. You have to have show him to your doctor at the same point of time, as soon as possible, as all these are signs of traction of the retina. And in few hours or in few days, your retina may become detached from its place. So these three things, that is, if your child is having floaters, that is multiple black color dots in vision, or flashing of light, or any decrease in vision, a curtain like thing coming from one side. So in these case, you should not wait and you should immediately go to a eye specialist. So all parents should tell their kid that these are few things. If he notices them at any point of time, please come to me and inform me.
Yeah, this is also really new thing which I have come to know about it. So thank you again for sharing that.
Welcome.
In which condition the child needs an urgent examination by an eye specialist?
So these are few things which I have already told now. So these three things, if child notices any flashing of light, any floater that is multiple small black color dots, or any decrease in vision, sudden decrease in vision, or any curtain like thing coming from one side. So in this condition, you should not wait. You should not waste time and immediately go to your eye specialist.
So I hope that we have answered all your queries in today's session, and we are open for queries here. So if anyone from the viewers have any queries, can type in the chat box. Dr. Kirti will answer the same. Yes, so Dr. Kirti, will you like to give some more insights, regarding this? Like, what are the things or the nutrition food we can give to our kids for their eye care?
Okay, actually, kids should eat all the food, like green leafy vegetables, all the legumes, all the fruits. So everything which we already knew, each nowadays we already knew that these are the healthy things which we as well as our kids should eat. So ideally, for all the kids, they should all eat all the kind of nutrition, health, including milk, butter, and all the things which we tend that they are healthy. As such, from our eye point of view, there is no particular specific thing. So as a routine, we should eat all the healthy things.
Yes. So that's really great to know. I see there is no queries in the chat box. You have given so much insightful details that I'm sure all the parents' questions must have answered. So thank you so much for coming on this episode of podcast and sharing such a insightful details with all the parents. And I would also like to say that as a kids wisdom coach, I am offering the free one-on-one call over Zoom to the parents, where they can discuss any parenting challenge they are facing. And I am going to share this Google form link in the chat box, so you can fill the form and book the slot. Also, I have posted the link to join my community for more such updates and details. So soon we will come up with our next episode in the series, so stay tuned for the same. Thank you everyone for joining today and watching our live session. And thank you, Dr. Kirti Rani, for
Welcome.
accepting our invite on such a short notice and giving such insightful details. Thank you.
It's my pleasure to help all the parents. Thank you,
Yeah,
everyone.
thank you.